In short, sleep apnea is the stopping and starting of breathing during sleep. Sleep apnea, commonly known as OSA or obstructive sleep apnea, is linked to obesity, aging, and underlying pulmonary or cardiovascular issues. So what actually is it? OSA is a sleep disorder in which breathing is briefly and repeatedly interrupted, meaning the affected person stops breathing for a short period of time whilst they sleep. These pauses in breathing can occur when the muscles in the back of the throat fail to keep the airway open during sleep. Often this is related to obstruction from the airways becoming relaxed or narrowed. How do you know if you have sleep apnea? Most will be told by their partner or those they are living with that they are snoring, gasping, or making choking noises during sleep. It may even be noticeable to others that breathing has stopped. A key indicator for the sufferer themselves is chronic tiredness and unrestful sleep. While some OSA sufferers do not exhibit all of the symptoms, they will usually experience one or more. However, some symptoms will be unnoticeable unless medical attention is sought. For example, low blood oxygen levels, hypertension, and heart disease. There are indicators you or your family may notice which should lead to seeking medical attention. These include mood change, feeling irritable, short-tempered, and depressed, memory problems, fragmented sleep, extreme tiredness leading to clumsy episodes, drowsy driving, change in eating habits, and sleeping during the day. There are genetic specialists that believe sleep apnea is passed down through families. However, there are many lifestyle factors that increase the risk of OSA that are more likely to be the most common cause. Being 40 years or older puts you at risk, although people in the age group of 65 and over are at a much higher risk than other age groups. Obesity also causes a higher possibility of developing sleep apnea. Stats show that generally around 9% of women and 25% of men in Australia have clinically significant OSA. What to do if you suspect you have OSA? If you or a family member suspects you may be suffering from sleep apnea, your first action should be to see your doctor. It may be useful to bring a family member along to help explain the concerns. This is because you may not be aware of some of them. The most common way to get a diagnosis is from a sleep clinic. Private sleep clinics allow bookings, or you can be referred by your doctor if he or she suspects you have OSA. Clinics like Sleep Health can help you with diagnosis and seeking treatment. To get a diagnosis, you will need to spend the night at a sleep clinic where you will be monitored throughout your sleep. Things like blood oxygen levels, brainwaves, sleep state, heart rate, and blood pressure will be monitored. It is possible that you will be asked to wear a CPAP machine, which is essentially a mask that helps you breathe as you sleep. Treatment type and next steps would be advised after your sleep study has been complete. The type of treatment you are given is dependent upon the severity. A common treatment is CPAP machines, also known as continuous positive airway pressure. There are also lifestyle-based changes and actions that you can take to prevent OSA and help to treat it. These include losing weight, wearing a specific gum shield for sleep, sleeping with your head propped up slightly, exercising and eating well, and sleeping on your side. Is treatment for OSA important? All treatment is important. Sleep apnea can be life-threatening at a more severe level. Whilst there have been cases of people passing away during sleep as a result of sleep apnea, this is in extreme cases. If mild cases are left untreated, it is likely the sufferer will continue to show symptoms explained above. OSA untreated is detrimental to health in the longer term and can result in stroke, heart attack, high blood pressure, and other serious health conditions. There are multiple things you can do at home if you are suffering mildly. There are also some basic medical treatment methods like gum shields or tonsil removal. To answer the question of treatment importance, it is vital for anyone displaying any symptoms of OSA to be seen by a professional. This is so appropriate treatment and advice can be given to that individual.